year, millions of middle school and high school kids around the country participate in sports through their schools or competitive teams. Pre-participation sports physicals are often required to ensure that kids are healthy enough to compete. But is there a level playing field when it comes to sports physicals? To find out, we asked a national sample of parents of kids 10 to 17 who play competitive sports. In terms of who should provide sports physicals, 57% of parents say it should be the child's usual healthcare provider, but 43% of parents say that any qualified healthcare provider can do a sports physical. For many families, this is a matter of convenience. Typically, sports physical requirements are tied to the beginning of the school year or the sports season. It can be very challenging for healthcare provider offices to fit in the rush of sports physical appointments during the busy summer months. So for many families, it makes sense to use a school sports physical night or get a sports physical at the urgent care center. Parents also have differing views on what should be included in a sports physical. As we see in this figure, the activities with the highest percentage rated as very important are measuring blood pressure and testing vision. And both of these things are easy to do in a group setting like a sports physical night because they don't require highly trained providers or expensive equipment. On the other hand, giving vaccines, testing for a heart problem with an EKG or echocardiogram, or doing an MRI or CT scan on a child with a prior concussion are less often rated as very important by parents and much more difficult to do. In addition, most parents feel it's very important to discuss the child's medical history and concussions, but fewer parents feel it's very important to discuss alcohol and drug use, nutrition, and performance-enhancing drugs, even though these topics can be very important for athletes. A notable finding in this poll is that 9 in 10 parents say a sports physical is not a substitute for a regular checkup with the child's usual healthcare provider. But we know national data show that adolescents have much fewer child visits compared to younger kids. So parents, cover your bases and make sure your little superstar gets the sports physical and the regular checkup with your child's usual healthcare provider.